Hi, welcome back to my channel. In this video, I will be talking about osteogenesis imperfecta and the most important pointers that you need to remember for exam. So, first of all, osteogenesis imperfecta has a lot of different names. So, you can remember three names. One is Lobstein disease. Then we have osteosarthrosis and fragilitis osseum. All right, now it is a defect basically in the col 1a1 and col 1a2 gene. In this, it is basically a defect of type 1 collagen defect. It can be qualitative as well as quantitative. Main feature is that it is the failure of fetal collagen to get converted into mature collagen. All right, then these are the defect types. Now coming on to the classification. Now foremost you need to remember one name, which is Silence. Now he divided it into four parts: first, second, third and fourth. All right, now in the first one, this is the mildest. It occurs in infancy. It is characterized by opalescent teeth and it is a quantitative defect. Whereas in part 2, you need to remember that it is the most severe and it is usually seen in utero, and you will observe fractures and everything, and it is a qualitative defect. Now you can just remember as all other types are qualitative defects. All right, and these are also seen in infancy. All right, now coming on to the clinical features. Now in clinical features, one important feature you should know about is blue sclera. Now why is it blue? Because the retina is abnormally very thin, due to which the pigmented choroid is visible. Now one important point you should know, that it is not pathognomic. Now it is seen in a lot of conditions. To remember those conditions, you can remember a simple mnemonic, which is phone PTM. All right, so we have fetal rickets, osteopetrosis, normal infants, Ehlers-Danlos syndrome. Then by P we have Paget's disease. By T we have Turner syndrome. By M we have Marfan syndrome. All right, then other clinical features are deafness due to the autosclerosis. Then we have laxity of ligament and abnormal electrical reaction of muscles. Now coming on to the oral manifestations, most important things that you should know is that there is class 3 malocclusion, there is maxillary hypoplasia, anterior posterior crossbite. Most important you should know is unerupted first and second molars are seen in osteogenesis imperfecta and impaction and supernumerary teeth. Now coming on to radiographically what we see is in bones, we see osteopenia, then we see bowing, we see multiple fractures, vermian bones, and in teeth there is premature pulpal obliteration. In histopath you will see that there is the cortex. It is thin, porous, immature, spongy bone, and there is defective microvascular system, and most important, there is decrease in collagen fibril diameter. Now in treatment, basically if the prognosis is poor though, but if it is 1, 3 and 4, then physiotherapy, rehabilitation and orthopedic surgery. So these are the important points that you should know for osteogenesis imperfecta, and I hope I made it easier for you to understand. If you like the video, do subscribe to my channel.